trying to find a good angle. Hey, that's gonna do. Hi, it's me, Nikki. I'm back to do a quick update. Well, maybe not so quick because you know how I like to ramble on and on. I'm gonna try to make this quick, but all right. So I had my operation, which was the DNC slash hysteroscopy slash Mirena insertion. Had that done. What was that? January 27th. Yep. And then now this is post-op. This is February 6th today. So it's February 6th, Thursday, making this video. Want to talk about some of my symptoms afterwards, like day 1, day 2, post-op was fine. February 4th, which was, or was it February 4th? February 4th. I went in for my 4th and last iron infusion that I have to have because due to anemia, due to having heavy periods, pretty much since I was 18 years old, I had heavy periods. They call it meningoria or something like that. And then they found out that I have out inserted. I butcher these words, y'all. I'm sorry about that. But I had the endometriosis that they found during the laparoscopic surgery back in 2018, whatever it was. I had a left fallopian tube removed due to hydrosalpinx and that. Then they also, a year later, found polyps plus endometriosis was back. So they removed all that. And now fast forward to the January 27th when I had the pelvic exam, they saw that my endometrium lining was thickened at 1.8 centimeters. So they wanted me to get a biopsy. So originally I was going to have the biopsy hysteroscopy in office. And I read horror stories about that. So I talked to my doctor and I was like, I don't want that. I would rather be put to sleep for this. Like, let's just do this. If you're not going to give me a hysterectomy, I'd rather just, So he was like, he agreed. So my surgery was January 27th. I did not at the time until February 4th, a couple days ago, 2 days ago. I went in for that iron infusion, 4th and last one. Hopefully it fixes me. I don't know, but I've lost a lot of blood and I'm going to tell you why. So February 4th, I get back from my iron infusion. Everything's going good. No reactions. I want to say it was like 12:30 and all of a sudden I just start getting back pains, lower back pains like that. You cannot understand, like, unless you have endometriosis and have bad periods and bad cramps. This is kind of what it felt like. So had that, and then all of a sudden, my videos are TMI still, because every once in a while I'll throw in some TMI. Okay, I still like to talk about my TTC journey and what I've been through. Every once in a while I throw stuff in. Okay, so this video you're gonna have to fast forward this because I will insert pictures and maybe a little clips. But I'm telling you guys, it's bad. So if you are squeamish and you don't like blood and you don't like to talk about these things, I swear you need to fast forward now. Anyway, I felt a gush. And I think if you're a woman, and most likely women are watching my videos, I don't know why a man would be watching my videos or whatever. I just don't see that. But if you are, hi. But you might want to fast forward this because this is gross. And you're kind of strange if you're watching this. Unless you're just curious and you're a doctor. Maybe you're a doctor. I don't know. Maybe you're out there getting information for your patients. Like hearing people's stories. Maybe that's why some males watch my videos. I don't know. And maybe you're doctors. Maybe you're nurse practitioners. I don't know. Anywho, there's a lot of blood. It was gushing. I'm talking waterfall. Not only that, I passed 8, like, bigger than quarter-size clots. Like I said, I'm going to insert pictures. So fast forward. All right. And it was scary. I felt the clots coming through. It was like a murder scene. It was bad. It was like a bad scene out of like a scary movie. So anyways, I told Mikey was getting ready to go to work that night to close. And I'm freaking out because I'm like, I have no one to watch the baby. She doesn't have daycare and everyone else is busy. So let's fast forward. I mean, it was like 3 hours of this crap. I finally call my gynecologist office, and the lady who always answers, I told her the situation. And she wanted to ask the nurse practitioner lady there, who's the gynecologist lady. She said, hold please. I told her everything. And she comes back on the phone and she says, oh, that's normal. That could be normal. It could just be your period starting. Now, I've done enough research on DNCs and stuff like this to know that you usually don't get your period back at least 4 to 6 weeks after a DNC is done. But it's rare, I guess. So I started thinking, maybe. But, you know, I don't know. So fast forward, day 2, February 5th, yesterday. Boom, same time, clockwork. It was like, same thing happened. Clots, gushing all day. It was like 3 hours straight of just nonstop, filling up pads, filling up toilet paper. Like, it was crazy. So I'm like, man, I gotta get pictures of this because, like, there's no way they're gonna believe me. I'm like, and if I I already have low blood, you know, I already have low iron, which is the whole reason why I get iron infusions. All right, everybody, so I had to cut that short. The rest of this video is just me going to work one of the nights and talking about my symptoms. All of these clips and pics and videos are leading up to my test results of the biopsy. So if you wanted to stick around, go ahead, fast forward to the end. It's my whole entire appointment. I recorded it. And thank you all. I hope you learned something from this. If not, because that's really why I made my channel, was for everyone to learn something from each other. All right. See you in the next one. Bye. Mommy loves you. Bye. Going to work.
Aw, say bye, Mama.
I got 2 bags. Okay. So I'm at work. I got to hurry up. It's so hard to find times at home to... I'm all out of breath. Update today. Like I said, it is 11 days post-op, past DNC, hysteroscopy, Mirena IUD insertion. I'm still spotting a little bit, but it's not big gushes of blood. TMI, remember, fast forward, it's not blood clots today. Maybe there was a couple of tiny ones, but it wasn't as crazy, man, as it has been the last 3 days. So, crossing fingers that the gynecologist knew what she was talking about and said, you know, maybe that's normal. I'm just hoping. So that's kind of where I'm at with all that. I'm just hoping. I'm just praying. I still have that biopsy result. So it's Friday right now as I'm talking. Tomorrow Mikey works 7 to 3:30. He's going to come home. We're going to clean up the whole house, get everything ready for Monday, which is my endometrial, you know, uterine biopsy, you know, results, which I'm hoping is going to be all right also. So if you could pray for me. Also, I want to talk about my I have lumps on my legs. I have a lump on my inside of my thigh here. It's been here for like 6 months, okay? I never thought anything about it. And then one on my outside. So I started bringing it up to people. I don't know if I brought it up on here or not with you guys, but to my friend, my sister, my mom, you know. I even brought it up to my doctor, and he said it could be a lipoma. So on February 18th, I'm going to go in and talk to my regular doctor, my family doctor, and he is going to do whatever he needs to do to figure that. He's going to feel it, and then maybe do a ultrasound on it. I don't know, and then biopsy. Who knows what I got coming. I'll keep you guys up and posted. It's been crazy, man. Okay, so because I'm still bleeding, they want me to dress from the waist down, undress from the waist down. So that's what I'm gonna do. I'm so nervous. I took Ativan. I'm still just so nervous.
Hey, you made it, huh?
I made it.
I get your pathology report. Everything was good. It was, there was a ton of tissue we removed. Oh my goodness gracious. But it was all benign. You had ovulated, actually, and
that's what that was.
And there was just a significant lining. There was no miscarriage. There was no pre-cancer, no cancer, or anything.
I couldn't sleep last night. I was crying.
Why is that?
I thought it was going to be cancer or something. I don't know why. I was panicking. I had my mom panicking. They're all like, should I come with you to your appointment? And I'm like, yes. But then I was like, no, I'm fine. I got this. I gotta be strong.
If I come in here,
I didn't know what I was going to expect. I'm like, they're gonna tell me I got dates.
Now admittedly, we've done a couple of these just like this in the last few weeks.
Yeah.
And one of them It was in fact a malignancy. And I put the IUD in, and I'm for, you know, what are you going to do? She didn't want to put it in the office, so we put it in, but, you know, we referred her. She's going to have definitive surgery. She'll be all right. She will be okay.
Mm-hmm.
But in your case, we're okay. And we've established your baseline.
Yes.
We've got the IUD in place.
Yes.
And I just want to check the strengths, make sure they're okay.
Yes.
All right?
I had bleeding, I don't know, like 3 days afterwards.
Mm-hmm.
Next thing you know, I got flooded with like, it was like period, but then it was like clots, and I was like, okay. Well, I called the office, they're like, oh, that's normal. I was like, okay,
And
good.
again, the reason we know that that's normal is because this was pre-period tissue that we pulled out.
I see.
So the ovaries have still programmed the lining of the uterus. There's still some to come out.
Yeah.
There we go.
That makes me feel a lot better because I was panicking. I couldn't even sleep. I'm like, I'm not gonna make it.
Well, we're not gonna let that happen. Okay, that's part of our job. I do need a little. Yeah, it's we did this on the 25th.
Yeah, the 27th.
27th.
Yep. Oh, sorry.
Okay.
27th. Is there a lot of blood down there?
So it's 2 weeks. Not bad. Let me just see here. Just scooch on down just a little bit.
Okay.
Let me do this. Did I get? Let's take a look.
Okay.
We expect this IUD to really take control of your situation.
Oh, good.
Within the next couple months, okay? I mean, that's just...
I'm so sorry.
No, you're fine. You're absolutely fine. We're just having to logistically play with this a little bit. Okay. Let me see if I can get a swab or two.
Okay.
So I can see. Oh, here we go. Yeah, we're ready.
I was so glad that they're benign, that everything was benign.
Absolutely, yes. we are equally as happy about that too. I left your string a little long. Let me go get a pair of scissors just so I can trim it a little bit. Okay.
Okay.
It's just
all right. So if any of you heard what he said that my biopsy results came back and everything is benign. That means, you know, no malignancy, which I can never pronounce that right. It's like non-cancerous. Thank God. And I'm thanking all my lucky stars, and thank you to anyone out there who sent me any positive vibes and thoughts and prayed for me. That's really awesome. Thank you so much. Basically, it's hard to hear. I tried to turn down the music of my video so you could hear him a little bit more. He didn't mind if I recorded, but he had to put a speculum inside of me to check why I'm still bleeding, because I am still bleeding. Let's fast forward all the way to February 13th right now, where I'm making this update and I'm editing all these videos. I'm going to finally put a video out so everyone knows that I'm okay. Anyways, yes, I am still bleeding, and my next plan is next we're going to do estrogen. We're going to try that. If I'm still bleeding, then he's going to do an ultrasound, pelvic ultrasound, I guess, to make sure that the Mirena is placed right. And then I think he actually said after that is talking about hysterectomy, which I'm okay with that. I told him.
When the uterus is bigger and when you've got it in the operating room, sometimes it just putting that IUD in seems like, man, you're putting it inside a big cavity, and but it went in very nicely, very easily. And we'll hope and pray that it will catch hold of the lining of the uterus.
Oh, that would be awesome.
And slow this and stop this.
Slow all this stuff down.
Scoot back on it. Because we expect, at least at this point, here, you get out of those things.
Oh, yeah.
We expect at this point that you will finish the period and sort of get back into the cycle.
Right.
But over the next couple months, we expect this IUD to shut down or significantly diminish the amount of bleeding. But safely.
That'll be awesome.
But safely. That's why we get it.
Thank you.
So
You guys
now,
saved my life.
if for whatever reason we go a few months and we're not getting this shut down, then we will ultrasound and make sure the IUD's where it's supposed to be in there. But we will also consider adding just a touch of estrogen for a few days, just to try, because sometimes it over suppresses the lining of the uterus, and then it breaks down and bleeds because it's too thin.
I see.
But it has not been in long enough to have made it too thin.
Okay.
And since it was secretory, what we did, we can remove tissue from the lining of the uterus, but what we can't do is we can't reset the ovaries. They're already on a preset schedule, which was set to continue for X number of days until such time as you weren't pregnant, therefore it was going to shed. Well, I sort of interrupted that and did the DNC, but that didn't mean that they weren't still on track to cause a period. Well, that's what we're experiencing, but we certainly expect that to slow down and or stop.
Yeah.
Just naturally, because we're starting a new cycle, but secondly, because we've got that IUD in place.
I feel so much better after today. Thank you so much.
The bleeding is a pain in the shorts, there's no question, but we seriously want you to keep track of it. Want you to let us know how it's going.
Yeah, I will.
And
I got my notebook.
yes, that's exactly what we want you to do. And again, if we're not seeing this significantly diminish within the next few days, we need to know that, because at that point we expect something to be better. At least on your own, to get back into the next cycle. To diminish the bleeding.
Okay. So I just gotta keep my eye on it, let you guys know. So if it goes away and if it stays, I gotta let you guys know.
If it persists like this after another week or 10 days, we need to know that. If it's starting to taper down and straighten out a little bit, then we just sit and hold our breath and wait and see how it goes.
Wow, what a weekend.
But you're okay. There was no cancer. Yes, there was a lot of tissue we removed, but there was absolutely no cancer, nothing like that.
Oh my gosh, not even pre-cancer, nothing.
No, nothing.
I'm good. Oh, now what about this lump on my leg? Remember I had to look at it a little bit? Hold on, that's right. It scares me sometimes. Hold on, right here.
Yeah, that is probably what we call a lipoma, a little fatty tumor underneath there.
Yeah.
But unless it's real prominent,
And here.
even the surgeon, they won't take those out.
Oh. Okay.
Just leave them alone.
So it's
I
not
actually,
cancerous, you don't think?
oh no, they're just little fatty.
And they've been there so long.
Just a collection of fat that firms up. It feels like a nodule.
Yeah.
But
And
we all
so
have
much anxiety, because I was like, man, I'm just filled with cancer, I told myself. I'm like, this is it.
in that case, I'd take a nice vacation and forget about it. So,
all right.
No, you're okay. You're okay. And I think, again, you're keeping track is the best thing you can do to help us help you.
Okay.
Because this doesn't always work, but it was a good thought.
It was a good thought. I think we're gonna.
Just have to be patient with it for a while.
Yeah.
I think it will.
I got nothing to lose. You know what I mean?
No.
So keeping it in there.
Don't want to have to resort to hysterectomy. And remember, at your age, endometrial ablation can be done.
Yeah.
The problem is, as we may have talked about before, even if it works today, when you get to be around menopause, if you have any bleeding, there's no way to evaluate it, because the lining of the uterus has been scarred, and then you end up with a hysterectomy just to make a diagnosis. And that's not a good thing.
Okay.
So we don't want to put you into that bind if we don't have to. Okay?
Okay.
Just relax.
Thank you.
Just relax. Watch your step.
Thank you so much, doctor.
You're welcome so much. Keep smiling. You've got important things to do with your little ones.
Yes.
Keep us posted.
I will.
We're here to help, okay?
Okay.
Do you need a pad or anything like that?
I got. Oh my God. Thank